I want to encourage you to dig down into the root cause of what's going on in your system. If you don't feel good, if you have a really hard time managing blood sugar or weight or your mood or your sleep or your hormones, we have got to get down to the root cause. It does occur in the gut, but guys, listen, it can cause so many things in your body to go wrong. Hello everyone, I want to come to you and give you some tips on just some simple testing, and as I put in the captions, I want to talk about Candida. So this is something that it comes up in conversation. What is Candida and why do we test? Okay, I want to tell you that you could be doing a lot of things right and not getting the proper absorption in your GI system because of overgrowth of bacteria, fungus, yeast, Candida, even SIBO, okay, and small intestinal bacteria overgrowth. It is a very important topic. There's huge links between Candida and also autoimmune conditions. There's huge links between a breakdown of that bacteria in the intestines and celiac disease, malnutrition, just not absorbing the nutrition that you need. I recently talked to a young girl who told me that she could take numerous Motrin around her cycle time to try and get some relief of cramping and pain and the internal inflammation that was going on, and she would get no relief. And that was during her consult of just that eye-opening conversation of how bad her overgrowth of Candida was in her intestines, in her gut, and not allowing that proper absorption to occur. So it's very important. Again, you could be doing all these things right and still not feeling good because of this simple thing. So what is it? So Candida is a bacteria that it should be in your gut in a normal environment. Okay, some is always good. Just like when we eat, everything is wonderful in moderation. It's not to be starved out, but if there is an overgrowth, then it does become harmful to our bodies. So Candida overgrowth, it is the most common form of a fungal infection. So that is I test for yeast and I test for fungus. And how do I test this? Let me just kind of break it down real quick. It's not hard. It's not you don't have to go to a doctor. You don't have to sit in a waiting room. But when I do my food sensitivity testing, I also test for yeast and Candida. Just so I know that when we do start making changes, you can get efficient, fast results. Like I had mentioned, we could pull out a lot of inflammatory foods and start filling your nutrition plan with all this wonderful, nutritious, organic fruits, vegetables, meats, all this wonderful food, but your body not absorbing and getting that benefit. So I want to make sure that you're getting maximum benefits from the beginning. So if you find other food sensitivity testing, some of those test for and can only detect foods that you've eaten a lot of and have an abundance in your body. You don't want that one. You want one, like yesterday I met with a girl who, I think she was 10 or 11, an octopus showed up on her test. So we know she hasn't eaten octopus, and we know that's not something in her system, but this is a true test. And by that finger prick, it's a simple finger prick, we also test for yeast and Candida. Okay, and so it is a fungal infection in the body. And most of the time when we see this in our blood, it's because there is an overgrowth. Okay, there's too much. And breaking down that intestinal wall, if this is the intestines, and that's a pretty big intestines, but if that was the intestines, there's usually some hyperpermeability that has occurred in that intestinal wall, and that Candida, that overgrowth of the fungal or the yeast is leaking out into our bloodstream. So by a simple finger prick, we can detect what is going on in our body. I want to encourage you to dig down into the root cause of what's going on in your system. If you don't feel good, if you have a really hard time managing blood sugar or weight or your mood or your sleep or your hormones, we have got to get down to the root cause. Until I focused on nutrition, I could not get my kids' respiratory conditions, ear infections under control, skin conditions under control. I could not get my hormones or my mood under control. Still, when I eat, off track, which it's life, we do it right, I can tell the next day that I'm having to be more patient with myself so I don't have that negative mood. So it's very important to get down to that root cause. Let me look over my notes real quick because I wanted to kind of look at you. So it does occur in the gut, but guys, listen, it can cause so many things in your body to go wrong. So what could it be? Like, what are some conditions and how may you feel if you have that would make you want to get this tested, that would make you think, well, I may have a Candida overgrowth. So if you have like athlete's foot, oral thrush, toenail fungus, we took care of a lady's toenail fungus in just a miraculous way, quick in taking care of a Candida. And you can battle these things forever if this is living inside of you, okay? So like that, just getting down and taking care of that. And it's not hard at all. But if you're feeling tired and worn down, that can be from your food, your nutrition, eating things that are causing your blood sugar to be dysregulated. We want to stabilize blood sugar and stabilize the gut bacteria inside so we don't have a dysbiosis going on. It can contribute to chronic fatigue and fibromyalgia. There's that huge link between Candida and autoimmune conditions. Digestive issues such as bloating, constipation, diarrhea, you name it, it is linked to the poor absorption, the Candida, the lack of nutrients, nutrient deficiencies. I hear a lot of people saying, they take vitamin D, but their vitamin D levels are low, or you're taking vitamin B, even shots, and which that's not really how it's absorbed. So we want to make sure when you're taking a supplement or vitamin that your body is getting the true benefits. So autoimmune diseases such as Hashimoto's, thyroiditis, rheumatoid arthritis, ulcerative colitis, lupus, psoriasis, scleroderma, and multiple sclerosis are all linked, okay? And it's hard to determine what came first, but a lot of times we see that our diets, our standard American diets, have contributed to this overgrowth in our intestines to where we have this dysbiosis going on. There's too much yeast, there's too much fungus, and we need to take care of it. So difficulty concentrating. If you have poor memory, ADD, ADHD, that again, back to brain fog, just a lack of focus, Candida can be the underlying cause and reason to those issues. And here, let me touch on skin issues. If you are having any skin issues, if you have been diagnosed with eczema, which eczema is one of those diagnoses that I've talked about before, where they don't know what's wrong with you, kind of like fibromyalgia. They don't know, so they're just going to put this diagnosis on there, which I call a Band-Aid, so they can prescribe medication. And that's not really why we go. And I don't. I want to know, how can I help this? How can I fix it long term? Not put a Band-Aid on it. But if you have a skin issue, you have to look at your gut. Okay, your skin is a mirror image of what's going on inside. So rosacea, psoriasis, eczema, hives, any type of rash, I will tell you, I'm an open book. And if my clients are watching, I'm an open book. Okay, my son has a rash right now. It's either from external allergies or eating somewhat poorly over the Easter weekend. Now, my somewhat poorly for him is not, McDonald's or anything. It's not going out and having fast food, but more sugar. is what I would consider to be what happened this past weekend. Is perhaps more sugar, a little bit more exposure to external elements right now because we were playing soccer. So I brought him home on Sunday night. We started a detox, and he is having he's rashy. Now, I have gone in years past, many years ago, I have gone and sought attention for a rash, and thankfully I was at the right hand of the right doctor who's looked at me and said, listen, his rash is wonderful right now as a sign of detox. Okay, so if you're going through a detox program, I want you to know that a rash can be just a sign of things coming out, but that lets you know we have to detox our bodies, like things have to come out. We don't want them to stay inside. So if it's not hurting, it's not itching, it's not breaking down to where you're having open wounds, then sometimes that rash can be a positive sign of detox, and we don't want to overreact with that. Sorry about the tangent, but I do want to just frame it to where you know how to read symptoms and know when that you need to respond in a positive or negative way. And honestly, when you are going through a detox, whether it's headache or rash or whatever, we have two decisions to make, right? Slow down and pull things back, or speed up and let's push through it. So if it's a headache, you would have to say, okay, what am I doing today, tomorrow? Do I want to speed up and push through this? Or do I need to slow down so it's a more gradual, may last a little bit longer though. So those are some decisions that we talk through and we have to make. Irritability and mood swings, anxiety, depression. I mentioned to you, when I eat bad, I feel my mood swinging. It can be directly related with blood sugar dysregulation as well. But you can also get infections such as a yeast infection, other vaginal infections, urinary tract infections, rectal itching, or vaginal itching, any type of itching. I have cleared this in women of all ages and girls of all ages, 9, 10, okay? So we're talking, it can happen young and it can happen old. And I won't, and a lot, even then, I think most cases, we need to go in and look at what's inside of our intestines, okay? What's inside of our colon, what's there that we need to take care of. So severe seasonal allergies, if they are worse, you want to get down to the root problem. When you get down and solve your root issues, your seasonal allergies can be so minor compared to what they were. If you've followed my story, we were only allergic to everything outside. There was no, some of the first few years of allergy testing and skin pricking and all that horrible, I just call it trauma to our body when they're pricking the skin and getting, all the webs. From a traditional allergist, we were told that we only were allergic to everything external and no food. I, within 3 years, found out that was completely false. Tyler is highly allergic to corn and egg, and had a vaccine reaction that had the albumin and the corn and all these things in it. So, and he was also diagnosed with celiac disease, and which I think was because he had had so much exposure to corn and egg. So the GI system, the duodenum, everything was broken down. But we can eat gluten now. So, here you have a celiac disease child and we're eating gluten. Not often, but, he does not react to gluten. I'm just going to put it that way, unless it's mixed with corn and egg. So, but highly allergic to those two. So put that together and there was this huge explosion going on in the GI system. Now, why did I bring that up? Only because at that point in time, we were allergic to everything outside. When we have had an internal focus and centered ourselves around nutrition and what our body needs, our seasonal allergies are da-da. We go out and we play every single day, every day. We take zero medication. We are not suffering at night. There are times when it's red eyes and sniffy at the end, but I consider that somewhat normal and tolerable. And we have some detox methods that we use at home that are 100% natural, so we are not taking medications for allergies. If you have itchy ears or recurring sinus infections or ear infections, Okay, ear infections are a bacterial infection, and I want to encourage you to look beyond the ear infection and say, okay, why am I carrying all this bacteria that keeps showing up in my body as these ear infections? And cravings, okay, cravings such as sugar. All right, and why do I say that? Sugar and carbohydrates that are converting to sugar are feeding the Candida. This Candida is like gremlins. If you've ever seen the movie, they just want water, water, water. All right, and they want water so they can multiply. And this Candida inside of you wants sugar and it wants carbs so it can continue to grow and be fed. Very similar to this a cancer cell. Okay, very similar to just that where we feel we're addicted and that we're out of control. Okay, and what I tell people all the time is you've got to find your competitive nature. You've got to find that competition inside of you that says, is what I eat going to serve me, or is it going to serve the Candida bugs? Okay, and when you frame your mindset around you being in competition with Candida, you being the person who's going to succeed and win and thrive and have the energy and have clear skin and really suppress the autoimmune diseases, then you will find the energy to take care of yourself and eat right. Okay, and I don't mean every day. Yes, you can go, and enjoy Easter lunch with your family, but I mean come back and get back on track to serve your body and treat it well. Okay, so you can thrive, so you can live energetically, so you stop questioning, why do I feel bad when all the test results look good? We've got to get down to the root of what is going on in our bodies. What is harming our systems? What is causing these chronic conditions, or these conditions that they seem chronic, like fibromyalgia, eczema, all this? It can seem extremely chronic because it's affecting our day-to-day. But there's an underlying reason as to why you have that diagnosis of and there's a name for it. I've said it before in my videos and it's not coming to me right now, but where it's just a broad term so they can treat you and give you medication to dampen your symptoms instead of supporting the systems. All right, so I hope this has been helpful. I do, like I said, look very deep at why you are having the symptoms that you're having. There's many things that can contribute to Candida that, we can look at, have you had a high sugar diet? And sugar can be, any type of syrup, fruit juices, corn sweeteners. Y'all, there's corn syrup in just about everything. All of our sauces and stuff today have corn syrup, whether it's high fructose or not, I really don't care. But the corn sweetener is something that is contributing, cane juices and maltodextrin. Look at maltodextrin. It's a huge contributor to Candida. So not only do we discover what's going on in the body, but we look at all the contributors so we can remove those. At the same time, we're treating it and giving your body the proper nutrition to rebalance and go back in and increase absorption so you get maximum benefits. If you have any question, any symptoms that I may have mentioned and you're interested in learning more, reach out, book a time on my calendar, simply call me, text me, message me on Facebook. I am here to help you and would love to talk to you. But we're a very competitive family, so I love talking about Candida. I love talking about being in competition with these sugar bugs per se in our body, and I want you to be the winner. So I hope this has helped. Have a great afternoon, and I will talk to you soon.